Thank you all for joining me to discuss the case of my patient Belinda. For those who may be unfamiliar, I'm Dr. Knoop, specializing in internal medicine. Today I'll be presenting Belinda's case and welcome any additional insights or expert opinions. In the medical field, I firmly believe in the importance of continual learning and being open to new perspectives on diagnosis and treatments. Allow me to introduce you to my patient Belinda, a 6-year-old Hispanic woman who's come to see me due to increased fatigue. Standing at 5 feet 3 inches and weighing 185 pounds, Belinda's vital signs during the visit revealed a blood pressure of 130/85. She reports having a good appetite but has noticed a recent increase in thirst. Unfortunately, Belinda's family history is quite limited. Despite my best efforts to gather information, she has little to share as she was adopted as a baby with no knowledge of her biological parents or siblings. This lack of family medical background poses a challenge in understanding any hereditary factors that may be relevant to her current health issues. As her doctor, it's important to approach diagnosis with caution and through investigation. Belinda's symptoms of increased fatigue and thirst could potentially indicate various underlying conditions. Given her age, weight, and vital signs, along with her reported symptoms, several possibilities can be considered. One possibility could be diabetes mellitus, particularly if her increased thirst is accompanied by frequent urination and unexpected weight loss. Another consideration might be hypertension, given her elevated blood pressure reading during the visit. Additionally, issues related to the fatigue could point to anemia or thyroid dysfunction. However, it's essential to conduct further diagnostic tests, including blood tests to assess glucose levels, enzyme kinetics, urine analysis, thyroid function, and a complete blood count (CBC), among other things. To confirm or rule out these potential diagnoses, additionally I'll be conducting a comprehensive physical examination which will provide valuable insights into Belinda's overall health status. Ultimately, the exact diagnosis will depend on the result of these investigations and the clinical judgment of her healthcare provider. I feel it is crucial to approach Belinda's case with a holistic perspective and to tailor the diagnostic process to her individual needs and circumstances. Following my physical examination, I did not identify any significant findings that warranted additional testing beyond what I previously mentioned. I proceeded with the initial battery of tests, utilizing samples of the patient's blood and urine to aid in diagnostic analysis of glucose levels. The following clinical tests were conducted. A glucose meter was utilized with a drop of blood placed on the designated area of the test strip and inserted into the meter for measurement. A Benedict Regent test was performed on a portion of the patient's urine sample to observe any color changes indicative of glucose presence. A Regent strip test was conducted using a small portion of the urine sample to determine glucose levels. Belinda's results for the glucose test returned as abnormally high. Additionally, it's noteworthy that glucose is a 6-carbon molecule. Being labeled as abnormal high in the context of a glucose test indicates that the glucose levels in the patient's blood or urine are elevated beyond the normal range. This can signify hyperglycemia, a condition characterized by high blood sugar levels. Hyperglycemia can occur due to various factors such as diabetes, mellitus, stress, certain medications, or underlying medical conditions affecting glucose metabolism. Elevated glucose levels may lead to symptoms such as increased thirst, frequent urination, fatigue, and blurred vision. It's essential for me as her healthcare provider to further investigate the underlying cause of the high glucose levels and formulate an appropriate treatment plan to manage the condition effectively. In order to aid in the diagnostic analysis of enzyme kinetics, clinical tests were conducted using samples of the patient's blood and urine. These samples were processed in a spectrometer, and the resulting data is now prepared for graphing. The patient's results revealed that the levels of creatine kinase and the lactate dehydrogenase are within the normal range. This suggests that there are no abnormalities detected in these particular enzymes. Regarding digestive enzymes, there are 3 main types involved in the breakdown of different macronutrients. Amylase. This enzyme is responsible for breaking down carbohydrates, such as starches and glycogen, into smaller sugar molecules like glucose and maltase. Lipase. Lipase plays a crucial role in the digestion of fats. It breaks down the trisurgeons into fatty acids and glycerol, which can be then absorbed by the body. Proteases are also known as proteolytic enzymes and peptidases. Proteases are responsible for the digestion of proteins into smaller peptides and amino acids. These digestive enzymes work together in the gastrointestinal tract to facilitate the breakdown and absorption of nutrients from the food we consume. It is safe to say Belinda's results suggest that there are no abnormalities detected in these particular enzymes. A series of clinical tests were conducted using portions of Belinda's urine sample to aid in diagnostic analysis specifically for urinalysis. For the protein test, an 8 milliliter portion of the urine sample was subjected to boiling and examined for the formation of precipitate. If a precipitate was observed after the initial boiling period, acetic acid was added, and the sample was boiled again to further assess protein levels. The patient's results for the protein test returned within normal limits, indicating that there were no significant abnormalities detected in the protein levels of the urine sample. In addition to the protein test, rather than utilizing a urine meter and a cylinder apparatus to measure specific gravity, the laboratory employed reagent strips that assessed both specific gravity and pH simultaneously. A small portion of the urine sample was applied to these reagent strips for analysis. The specific gravity of the urine sample was found to be within normal range, suggesting adequate concentration levels. However, the pH level was deemed abnormal, showing a low value. A low pH value in the urine indicates acidity, suggesting that the urine is more acidic than normal. Normally, urine pH ranges from about 5 to 7, with lower values indicating increased acidity and higher values indicating alkalinity. Several factors can contribute to a low urine pH. These may include diet, certain medications, dehydration, or underlying medical conditions such as metabolic disorders or urinary tract infections. For example, if Belinda's diet is high in protein or acidic foods, can lower urine pH, while conditions like diabetic ketosis or renal tubular acidosis can also lead to acidic urine. Remember, understanding the significance of a low urine pH is essential in diagnosing and managing various health conditions. It can provide valuable insights into a patient's metabolic status and help identify potential underlying issues that may require further investigation or intervention. Therefore, when interpreting urine pH results, it's crucial to consider the patient's overall health status, medical history, and other laboratory findings to determine the appropriate course of action. Furthermore, the original observed color of the urine sample was noted as normal, providing additional context to the overall assessment of the urinalysis. Next, an electrolyte panel was conducted, and the results were provided, revealing decreased levels of phosphate ions. This outcome was labeled as abnormal, low, decreased. Laboratory utilized reagent strips that also assessed bilirubin simultaneously. Upon application of a small portion of the urine sample, it was found that the ketones were abnormal elevated while bilirubin was negative. Furthermore, the Ehrlich reagent test was performed on a portion of the patient's urine sample to detect any color changes. The results indicated normal, none suggesting the absence of specific substances that would cause a color change in the urine sample. Based on the presented information and test results, it's highly likely that Belinda's is experiencing hyperglycemia. Several indicators that conclusion: elevated glucose levels. The glucose levels returned as abnormally high, both in the blood and urine sample. This indicates that Belinda's glucose levels are elevated beyond the normal range. Symptoms consist of hyperglycemia. Belinda reports the increased thirst, which is a classic symptom of hyperglycemia. Other symptoms such as fatigue are also commonly associated with high blood sugar levels. Presence of ketones in urine. Ketones were found to be abnormally elevated in the urine sample. Elevated ketones levels can occur in conditions like diabetic, which often accompanies severe hyperglycemia. Possible metabolic acidosis. The low urine pH suggests increased acidity, which could be related to metabolic acidosis commonly seen in uncontrolled diabetes, especially during the episodes of DKA. Considering these factors, hypoglycemia is a significant concern for Belinda. Another potential diagnosis for Belinda: diabetes mellitus type 2. Elevated glucose levels in both blood and urine samples suggest hyperglycemia, which is a hallmark of diabetes mellitus. Increased thirst and fatigue are common symptoms of uncontrolled diabetes. The abnormal elevated ketones in the urine indicated ketosis, which can occur in uncontrolled diabetes. Other symptoms such as increased urination may be present but were not explicitly mentioned. I will need to conduct further tests such as HbA1c levels to confirm the diagnosis and assess long-term glycemic control. Metabolic acidosis. Low urine pH suggests increased acidity, which could be due to metabolic acidosis. Metabolic acidosis can occur in uncontrolled diabetes, especially during episodes of diabetic ketosis. DKA can lead to symptoms such as fatigue and increased thirst. Decreased phosphate levels, as indicated by the electrolyte panel, can suggest hypophosphatemia. Hypophosphatemia can occur in conditions such as uncontrolled diabetes, malnutrition, or certain metabolic disorders. Further investigation is necessary to determine the underlying cause of hypophosphatemia and its potential contribution to Belinda's symptoms. Given the potential diagnosis of diabetes mellitus type 2, metabolic acidosis, hyperglycemia, and hypophosphatemia, as well as the symptoms Belinda's experienced, here is a potential treatment plan. Diabetes mellitus type 2 management. Lifestyle modifications. Encourage a healthy diet rich in fruits, vegetables, whole grains, and lean proteins. Limit intake of sugar foods and beverages and encourage portion control. Also, emphasize the importance of regular physical activity. Medications. Intake pharmacological therapy as necessary to help control blood glucose levels. Insulin therapy may be required if blood glucose levels remain uncontrolled despite oral medications. Blood glucose monitoring. Instruct Belinda to monitor her blood glucose levels regularly using a glucose meter to ensure they are within target ranges. Management of metabolic acidosis. If Belinda exhibits signs of severe metabolic acidosis, such as altered mental state or dehydration, she may require intravenous fluids to correct electrolyte imbalances and improve hydration status. Treatment of underlying cause. Address the underlying conditions contributing to the metabolic acidosis. In this case, optimizing diabetes management to prevent further ketone production and acidosis is crucial. Treatment of hypophosphatemia. Oral phosphate supplements if hypophosphatemia is severe or symptomatic. Oral phosphate supplements may be prescribed to replenish phosphate levels. I still need to determine and address the underlying cause of hypophosphatemia, which may include diabetes management, nutritional deficiencies, or other contributing factors. Education and monitoring. We will provide comprehensive education educating Belinda about her conditions, including diabetes management, dietary modifications, the importance of medication adherence, and recognizing signs of complications. Belinda will need regular follow-ups. She will need to schedule regular follow-up appointments to monitor Belinda's progress, adjusting treatments as needed, and address any concerns or questions she may have. I will consider involving other healthcare professionals such as a registered dietitian, diabetes educator, or endocrinologist to provide cohesive care and support. Lifestyle modifications. Emphasize the importance of maintaining a healthy lifestyle, including regular exercise, stress management, and adequate sleep. Encourage smoking cessation if applicable, as smoking can exacerbate complications associated with diabetes. This treatment plan is tailored to Belinda's individual needs, taking into account her limited medical history, lifestyle preferences, and potential contradictions to specific medications or interventions. Close monitoring and regular follow-ups are essential to assess treatment efficiency, manage any potential complications, and optimize Belinda's overall health and well-being. Thank you for joining me for the updates on Belinda's condition. Belinda is committed to implementing significant lifestyle changes, adhering to her medication regimen, and diligently monitoring her glucose levels. Our follow-up appointment is scheduled in 2 weeks, during which we'll assess her progress and make any necessary adjustments to her medication plan.